Stem cell research is beginning to show credible promise in treating various medical conditions. At Kuala Lumpur Sports Medicine Centre, KLSMC, our success in stem cell therapy for articular cartilage regeneration, especially for those with knee problems, is a result of an extensive research and development program. If you decide to undergo stem cell therapy for articular cartilage regeneration, our orthopedic surgeon will assess you clinically, taking into consideration of your medical history. Medical examination includes X-rays and MRI scan to assess the suitability of your condition for stem cell therapy. An arthroscopic keyhole surgery will be performed on your knee. The aim of the surgery is to remove damaged cartilage and create small drill holes into the damaged area. This procedure will take approximately 2 to 3 hours under anesthesia. Further procedures may be required if meniscus or cruciate ligament injury is present. You will be required to stay in our ward for a minimum of 1 day. Following surgery, physiotherapy will be initiated involving continuous passive motion of the knee for 2 hours every day for the first 4 weeks. 1 week after surgery, you will begin the harvesting procedure in our day ward. 3 doses of Neupogen, which is recombinant G-CSF, will be given to stimulate your bone marrow to increase the production of stem cells. This will be administered under the skin of your abdomen daily for 3 consecutive days prior to the harvesting procedure. Side effects from the injection are generally minimal and may include rash, bone pain, headache, and occasionally redness and discomfort at the injection site. On the day of the stem cell harvesting, you'll be required to take 2 calcium tablets with your breakfast. A gown will be provided upon admission. A doctor will utilize an ultrasound machine to locate your femoral vein at the groin area, and local anesthesia is then administered. The apheresis catheter is then inserted into the femoral vein. Once the catheter is inserted, your blood sample is taken to determine the number of white cell counts. This double lumen catheter will allow blood to flow from the femoral vein into a blood cell separator. The blood cell separator creates a centrifugal force to separate the various components of the blood, like plasma layer, buffy coat, and the packed red cells layer. After separation of the blood components, the stem cells layer is harvested, and the rest of the blood components are then returned to the body via the double lumen catheter. Complications are minimal. However, some patients may feel lightheadedness, especially at the beginning of the procedure. To prevent blood clotting, an anticoagulant, such as an acid citrate dextrose, is added to the cell separator. This may result in symptoms of pins and needles in the fingertips or lips, palpitations, or a feeling of being unwell. These symptoms can be minimized by the calcium supplements taken prior to the procedure. Harvesting process takes 2 to 3 hours, during which you may read a book or have a light meal. When the harvesting process is completed, the catheter will be removed and a light dressing will be applied, which can be taken off in the evening. You will be placed on a head-down position for 10 minutes, following removal of the catheter. This is to minimize bleeding at the catheter site. After your stem cells are collected, it will be sent for processing in our laboratory. 8 milliliters of your fresh cells will be separated for immediate use, while the remaining stem cells are labeled and cryopreserved in liquid nitrogen at -196 degrees Celsius. The fresh stem cells will be mixed with 2 milliliters of hyaluronic acid for your first injection into the knee joint. Before injection, your knee will be iced to reduce pain, antiseptic solution is applied onto the injection site. There may be some discomfort following injection of the stem cells. Excessive activities should be avoided in the first 24 hours. You are required to have a family member or friend to drive you home. In the subsequent 4 weeks, additional stem cell injections will be given weekly. Our technique in regenerating articular cartilage of the knee is simple and can be performed arthroscopically in a single procedure. It is possible to treat large defects, multiple defects, and kissing lesions of the joint. Our early results lead us to the conclusion that cell therapy will have an integral part in the future treatment of cartilage damage, as well as other potential orthopedic, surgical, and medical applications. Kuala Lumpur Sports Medicine Centre, redefining sports medicine today and for the future.